audible? Hello?
Yes, na,
You
you
are
are
visible.
audible.
Yes. Okay. So, uh, um, there's a old saying that says a journey of thousand steps starts today. So the journey to USMLE is actually very, very long, but if you start early and if you have the right guidance, it's very achievable. There are a lot of myths about how this is not doable at all, or it's very extremely expensive, or that it takes a lot of time. All that might be true, but it's definitely doable. And if you have the right mentors, and thankfully I did have mine, and that is exactly why, even though I started much later in my journey, it's always better. And I have been here and with all that guidance, so I would like to reciprocate and do the same thing. So I appreciate Namma Medicine for having this platform to like help others guide through the same process as well. So when it comes to USMLE, it is short form for United States Medical Licensure Exams. You require something called as ECFMG certification. So what ECFMG certification is, it's a commission that certifies foreign medical graduates. So for that, the requirements are three steps. USMLE Step 1, USMLE Step 2 CK, OET, and Step 3, which is an optional thing. So Step 1, earlier it used to be a scored exam, but now it has become pass and fail since last year. So this has been a major change in the way USMLE is seen. So earlier it was just about USMLE Step 1 scores, Step 2 scores, and how you performed in your Step 2 CS. But right now, the Step 2 CS has been cancelled, and the Step 1 has become pass-fail. And with Step 1 becoming pass-fail, the Step 2 CK score is also primarily more of a concern, because the better the score, the better your profile appears to be to the interviewer. So, and there's another exam called Occupational English Test that is going to just examine you based on how well you can communicate with the patients, and what your knowledge and being empathetic, and how well you have a rapport with your patient. So when to start your preparations for USMLE? You're never too late, although the sooner the better. So the best case scenario would be to start while you are in medical school. So again, another saying is that the best time to start was yesterday, the next best time is now. So I would ideally suggest, if you are a medical student, to start researching on what you can do to make your profile a lot more better. So the ideal thing would be to decide on what kind of specialties you want, either surgical, non-surgical, internal medicine, OB-GYN. So there is first just having a prior understanding of what kind of specialty you choose to become actually delineates a lot of things. Another thing is, there are three different things. There is something called as electives. There is something called as observerships and externships. So as a medical student, you are eligible to do electives. There are a lot of things that you are able to do as a medical student which you can't do as a graduate. So I'd highly suggest you'd start much earlier your journey to USMLE. If you're here to even understand the scenario of how you can progress to USMLE, that itself is a great start. So what is a holistic profile for the candidate? Scores are just not the predictor. So like how I mentioned about Step 1 going pass fail, and Step 2 CK is the only scored exam so far. What your interviewer is going to see when it comes to your profile is not just your score, but the way you're going to portray yourself entirely on your CV. So start from your medical school, how you have performed in your medical school, what your step 1 pass, Step 2 CK scores, and along with that, the US clinical experience that you have gained, the research publications. Hello?
Anna, sorry for disturbing you. Anna, are you sharing the screen?
Yeah, I am.
ஒரே ஸ்லைட்ல இருக்கு.
Oh, really?
Yeah, yeah.
And Doc, can you make it full screen?
Full screen and it's yeah, it's in yeah,
Yes,
no.
yes. It's in
Slideshow.
half screen.
Oh, okay. Wait. Mm,
Can I share now? Is it okay?
yeah, that'll be great.
Yeah. What I'm sharing.
Sure.
1 second. I will make Gaurish as a co-host. Gaurish, you please start accepting. Okay. I think you.
If I pop out, I will accept.
Yeah. I will share the screen. 1 second. Okay, it's ready. Can you see me? Can you see my screen?
No.
Can you able to see my screen?
Not it, not it.
Not it. So sorry, guys.
Wait, 1 second.
I think you can see now. Now?
No,
Just a second. Can I try it once again?
Yeah. Yes. No. Yes. No.
1 second.
Using my laptop, I know how to use it.
Is it better now?
Yes. No.
Yes. Yeah.
Yes. No. Yes. Yes.
Sorry for the inconvenience, guys. So I was here. So what your the interviewer is going to see is a holistic profile of what you are showing on your CV. So that includes your scores, your US clinical experience, which hospital or which clinic you have rotated, and what kind of experience, whether it is a hands-on experience that you have gained, and were you given an EMR access, whether all that is what is going to count. Apart from the US clinical experience, there is also research, publications, journals that you can be part of, the number of experiences that you have gained so far, the certifications that you have, along with that, the amount of volunteering you have done, and what kind of hobbies you have. So being part of Nama Medicine can be a volunteering experience. Being part of any line, like any other clubs in med school, literature clubs, all that can be added in your volunteer experience. So all these together is what shapes a good profile. So you can't just be like, okay, I have my great scores, so I'm going to apply. But an examiner is the view, like the interviewer is going to see you not just as a candidate with scores, but someone who they would be enjoying working with. So all these are what creates a great profile. So like I said, what a program director expects of you, a candidate who they can work with, a year of graduation. So there are certain filters when you are applying for specialties here in the US. So the year of graduation is one. So they always prefer a fresh graduate. preferably less than 5 years from the year of graduation. So a lot of Indian graduates, while doing their externship, delay their diploma and do these internships, externships, electives, so that they can be still a fresh graduate, at the same time get the US clinical experience along with it. So if you are an Indian graduate, you can consider doing that as well. So like I mentioned, step scores and clinical experiences, volunteer experiences, research experiences, and the academic performance in medical school. So how well you are performing in medical school, whether you're in top 10, all that can also help in your shaping a profile. So the programs do not prefer clinical gaps in career, but as long as it can be explained. So for example, reasons of gaps being health concerns, or being primary caretakers for somebody, or having raised a child, these are all reasons for clinical gaps. So these are not preferred, but at a scenario where it can be explained, it's always better. And as a student, you can do a lot of poster presentations, and then publications as part of your school faculty along with them. Those can definitely help improve your CV. And certificates in healthcare allied courses. So there are a lot of these courses that you can be part of. Internships for research experiences. There are courses for understanding how the healthcare system works. All that can also help shape your profile. So where to start? I would highly suggest have a mentor, because someone who's already done this has a better version of how this has to be done. And the number of mistakes that I have made and I have shared along to my peers has helped them but better. So someone, because there are everybody's journey with USMLE is totally different, it's always better to have a mentor who can guide you and also keep reminding you whether you're progressing or not. So that is something that is required. And the only thing about USMLE is it's actually a very lonely, it can get a lonely and a very long process. So lonely because when you are saying that you are doing, beginning to start preparing for USMLE, there is also a lot of naysayers that will say, no, you can't do it, or no, it's a long journey, this is not for you, or no, this is going to be a very expensive affair, and the likelihood of getting a job there is very inconvenient, like extremely minimal. So you have to find yourself the ground to stand them, and at the same time make yourself come out of all the anxiety that it can give, because definitely it's something that's a lot of uncertainty that belongs here. But at the same time, once you have matched, the perks of being at the healthcare system in US is going to be definitely rewarding. So the best way to start is find yourself a mentor. To all the people here, if you have any doubts and if you wish to for my further guidance, you can always ping me. I will pass the contact information of mine through Ari, so you can also take the same help from me. So when it comes to preparing for step 1 exams, because I would start with saying that because the step 1 exam has become pass fail, a lot of people just want to pass the exam. But I will highly suggest you to take time to fully understand the concepts of USMLE, fully understand the topics that are there, and then try to give an exam, because passing the exam can be easy if you understand the topics. And second, you're going to do a lot of favor for yourself if you understand these topics, because these topics are going to be recurring while you are preparing for step 2 CK or step 3 exams. So it's a very long exam. I do not remember how I sat for 8 hours. So the exam is going to be 7 blocks of 40 questions each, and each block will be 60 minutes. And there are preclinical subjects that are tested, and the exam results are pass fail. So the subjects are physiology, pathology, biochem, immunology, pharmacology, anatomy, and biostatistics, medical ethics. So what USMLE tests is how well you can communicate with your patients. So medical ethics is something that is very, very high importance when it comes to USMLE, because they want your doctor to be very empathetic. They want your doctor to speak to you like everybody. Every patient wants your doctor to be guiding them in the right kind of way. Every doctor will be doing that, but also some concern that also should be shown to patients is what they prefer. So ideally, when to give step 1 exam while you are in med school, start preparing as early as possible, because when you are preparing for these subjects, you're also doing yourself a favor, because these are subjects that you're doing in your first 2 to 3 years of medical school. It will help you understand the concepts better, because these questions are, the question stems for USMLE are much longer, and it is also very clinical in the sense that when you take a biochemistry question, they will still give it as a patient who is coming with so and so concerns. So it gives you a better understanding of all the topics that you are studying for medicine. So the duration ideally would be 5 to 6 months of active preparation. So what I would suggest is uh, get a realistic date set, because there is something called as burnout that is very real. So whenever you're preparing for this, for example, a lot of exams that are competitive exams are going to be scheduled by the country itself, and it happens. For example, if you take NEET PG right now, it happens only annually once, and it is scheduled already by the government. But when it comes to USMLE, you will be the one to be scheduling your exam. So in that scenario, you will have to be very confident in like setting a date for your exam for yourself. So ideally, start preparing for your exam and um, give a dedicated period of preparation to understand where you stand. And there are a lot of assessment exams which you can give in the meantime to know whether you're going to get a very good score, meaning you will definitely pass in step 1. So delaying the exam is something that happens. So I personally have delayed my exam multiple times because I had the fear of not passing. uh, but this is something that was not shared with me at that time, because if you constantly keep doing this, you're going to burn yourself out and not prepare confidently. But when you have set a time period that you will be giving the exam at a certain date, it always gives you that confidence of, okay, I'm really sure that I will be able to pass the exam. So keep a realistic date and do not prepare for like years together, because one major thing about all these topics that I've mentioned so far is that it's all very volatile. So you read biochemistry today and you remember tomorrow, it's very hard pass, because sometimes you tend to forget. The same thing with anatomy and pharmacology. So these are all very volatile. So I would highly suggest you prepare the exam and give it within a few months. Next, the resources. Right now, there are plenty of resources, but I will highly suggest you to minimize the number of resources that you are using. And there are free resources and there are also paid resources. So there is the gold standard UWorld question bank, which is online versus offline. So the difference with UWorld online versus offline is, online is an app or a website where you can go and solve questions, versus offline, there are like Telegram groups where they have PDFs of all these question banks that you can use to prepare for the exam. So the only thing about online exams is that it is going to give you a realistic score and a percentile of how many people have answered the question correct compared to you. So that gives you an idea of where you stand, and also it shows progress and improvement. So I'd highly suggest get a long-term UWorld subscription. It comes to around $400, $500, but it's definitely worth the use. Next is Pathoma. There are video lectures and the book. These are free resources, and it's a book for pathology, and the first three chapters are very high yield. So these are the primarily understanding pathology. So even if you are not preparing for USMLE, it's a great resource to understand pathology because it's free and it's also very structured. So there is boards and beyond, again video lectures and notes to understand topics. So if you're starting as a medical student, all of this might seem very daunting because you might not understand what I'm trying to say, but if you are using these resources, it might help you guide better. So there is boards and beyond, which is a video lecture, so you can watch the video and also revise using the notes. So it's very concise and it gives a brief understanding of what the topic is. Apart from that, the holy book, that is the first aid, it is actually a great revision book. So it's one book that contains all the information that is required for you to prepare for step 1, but it's not the ideal book to start preparing from. So when you're using other resources, the information that you are gaining from those resources, you add along with your first aid. Apart from that, there is other resources like sketchy medical videos for microbiology and pharmacology, and Anki flashcards. So if you are someone who forgets and requires a constant reminder of the mistakes that you have made, Anki flashcards is a great resource. There are free decks that are available online. So what it is flashcards that keep popping every few once in a while. So it's like there's this phenomenon called neuroplasticity. So the more you do a task, the more you are able to understand the task without putting your thought into it. So that's what is Anki flashcards. So the more flashcards you see, you are training your mind to understand the topics and familiarize yourself with all these topics. So that's a wonderful resource. I haven't used it during my step preparations, but I recently found it and it's absolutely something that I wish I had used. When it comes to UWorld, it is a learning tool per se. So you will be also given, after every single test that you give, a score and where you stand in terms of the people who have given the exam. So it can get intimidating when you're seeing those, but ideally you should use it as a learning tool and not compare yourself all the time. So you need to read thoroughly every bit of what is given in UWorld. So what usually UWorld contains is a question of 5 to 6 options for the question, and the discussion of why it is the right answer, why the others aren't the right answer, and a brief discussion of the topic that the question is from. So when you're reading the question, you're also preparing yourself for the differential diagnosis. You're also preparing yourself for the alternative diseases that this question is not testing. So that way it gives you a holistic idea of the entire topic. So you need to read thoroughly through the content. So ideally what you can do is a system-wise UWorld, where you are solving questions of, say, I'm right now preparing for anatomy, then I will solve questions in anatomy, and then I will move on to biochemistry, and then I will move on to pathology. But the only thing that's different when it comes to system-wise solving is when it comes to like system-wise for cardiology, or like say neurology, or say nephrology. So what happens is the options are going to be different. So when you're solving a nephrology module, you will feel like the option already is going to be the answer that is pointing towards nephrology. So you might tend to answer the right question because you know that it's a nephrology module. So that's one thing that can be difficult when you're starting out new. But over time, it gets you an understanding of how to use the UWorld question bank. And then there is also untimed versus timed. So when it comes to untimed versus timed, there is always timed is better, but untimed is for times where you want to like understand the concept even better. So when you're giving tests, always timed always works, because like I mentioned earlier, the exam is going to be 8 hours. So if you are going to time yourself and see how many questions you're able to solve within that time, it's always better. And usually what people say is, if you're able to get more than 70%, you should progress more in your world. So like I mentioned earlier, there are few mistakes that I had made during my prep for step one. So you need to review your incorrects and forgetful topics through repetitive flashcards. This I hadn't done. So if you are beginning your USMLE journey now, I would highly suggest you use Ankai flashcards, because that way you are able to like review the content that you are going wrong, the topics that you have a misunderstanding with, so that you are familiarizing with the topic. And don't passively learn. It is easier early on to just watch a video, but make sure you understand the concept well to help your future self. So there's this thing. So if you are preparing for NEET PG, if you're preparing for PLAP, or if you're preparing for USMLE, there's always this videos that are there. So if you start watching those videos, it's a infinite loop where you end up watching the videos, but the amount of understanding you have gained with just watching the videos is very minimal. So try to solve more questions, try to read the notes that you have created. So this way you will be having a better understanding of the concept, and also you will know where you stand with the concept, instead of, because the people who are like on the video are definitely pro in their concepts. So you need to understand the concept for yourself and not for them. So there are times where I used to play the videos for 2x or 1.5x and watch the video, but the amount of information that I had retained watching those videos were very minimum. So I'd highly suggest, don't do passive learning. Start solving questions, read the notes again, and discuss these topics with a few people who you are studying along with. Always have people to study with, because this way you have someone to like go through the process along with you, and at the same time you will have someone to discuss what you're studying with. Learn topics you find difficult first. It's easier to save them for later, but they definitely show up on the exam. So this is something. So I used to do, because I always consider dermatology as a simple topic. So I frequently revise and read dermatology again and again, because it's easier to me. But I have always personally felt that biochemistry for me was difficult, so I used to postpone it as late as possible. But if you do biochemistry, if I had done biochemistry first and then dermatology later, it would have been a lot more easier for me to know the difficult topics that I find, and read those and give more time for those, rather than constantly reading the same things that I know I'm already good at. So when or how you fix your exam date. So there's U World self-assessments 1 and 2, finishing one round or U World with all the 3,000 questions, and NBMEs. These are exams. National Board of Medical Education provides few question banks, or set of exams that you can give before you're taking the exam. So these are all free. 120 is again something that scores you in terms of percentage to understand where you stand. So these are things that can guide you in fixing the date. Like I mentioned earlier, you are the one who will be giving fixing the date for yourself. So in that scenario, it's always best to have these assessments done to know understanding of or having a surety of whether you will pass or not. So that way you have to make sure that you are giving all these assessments to properly fix a date. So this is exactly what you want right now. So this is uh, how a scorecard or a score report comes for USMLE Step 1. So when it comes to USMLE score report, earlier they used to mention your score and where you stand in terms of percentile. But right now they have changed into understanding of your test result being pass fail, and the concept areas that the question, the test was tested. So how to prevent burnout during prep? Like I mentioned, it's a very long and lonely process if you're doing it all by yourself. So start building your CV early on, so you can get research experiences, volunteer experiences early in your career to distract yourself and keep you occupied along with your study preparation. So and also start learning a new skill, a language, sport, or art. So like I mentioned, USMLE is going to look at your holistic profile. So the more skills you have, the more languages you know, the more sports you play, or the more you get yourself involved, the more you have something to speak about. So skills, you can always, there are so many courses online that you can do. There are certification programs for research from say NIH. There are certification programs from Coursera and edX, which you can always do and gain a new understanding. There is, for research, there is something called as R. There is data analytic tools that you can learn. There is when it comes to languages, I will highly suggest you start learning Spanish, because when you put on your CV that you know Spanish, it always creates an edge on your profile, because a lot of people here in the US prefer a Spanish speaking person compared to just an English speaker, because that helps them understand the patient dynamics. Another thing is involving yourself in sports and art. So as far as I know, a lot of people who have been interviewed before have had a longer discussion of like soccer or basketball compared to like medicine as such. So if you're showing interest towards a sport, it's always something that you can discuss with your mentors and peers. So this way you're building your personality. So now moving on to step 2, again, it's a very long exam. Passing score right now is 214, and a 9-hour exam with 8 blocks, 40 questions each, 60 minutes of break. So the subjects tested are clinical. So there's going to be medicine, surgery, OB-GYN, pediatrics, psychiatry, again, medical ethics and biostatistics. So when it comes to medical ethics, again, these are clinical scenarios where they're going to test whether how empathetic you can be, or the right thing to do as in a realistic setup of medical hospital, being in a hospital, etc. So these are topics that are highly tested, and you should prepare yourself for that. So again, for resources, there's UWorld, there is podcasts called as Divine Intervention. So even if you're preparing for NEET PG, or even if you're preparing for any other competitive exams, I suggest doing Divine Intervention podcast. This is like a podcast on the high yielding topics that are usually tested. So it's a very great resource for revising also. Even if you're a graduate, it's something that you can do to revise your topics. So there's also NBMEs for evaluation. So when it comes to CMS forms for revision, so these are tests you can give to prepare yourself for understanding where you stand. And definitely scores are important, but it's not the end of the world. So I know of people who have had very poor scores, but they have matched because they have a very, very good profile, meaning they have research, volunteer experiences, and no gaps in clinical gaps in their CV. So a drop in your score can always be compensated with rightly with your CV and how hard you have been working on yourself. Next is sources in social media and internet. So because there is not a lot of guidance when it comes to USMLE, I would highly suggest you follow these pages to understand where all you can retrieve resources. One more thing about USMLE is that it's a very expensive process later on in terms of your travel here for US experience, clinical experience. So in your journey earlier, it's always better to use resources that are free and available, because this way you're cutting short on the expense that you're creating for your journey towards the match. So there are so many of free resources like videos, question banks, books, podcasts that are there on Telegram. So I'll share the links later on, so you can always follow these groups and use the resources that are available for free. And Facebook has plenty of support groups where people discuss what worked and what didn't work for them. So what happens is there are these support groups where each of the people who are aspirants for USMLE share their difficulties. So if you are facing that difficulty, you can always take inspiration from that and take things forward, because that way you will know that you are not alone. And when it comes to Reddit, it's an anonymously posted information. So it makes people share real stories without any hesitation. So whenever you're starting in your prep for USMLE, or whenever you're like applying for US clinical experience, it gives you a realistic idea of how the experience was, and whether it's something that you should do or not. So apart from that, there is Instagram. There are plenty of study groups where they share daily progress and motivation. So for example, there are um, IMG Journey, who shares everyday solving of the questions, so that at the end of the day, people can be accountable for. So these are things that you can follow. I know these are all places where you can get distracted, but if rightly used, it's always free and it's always best. So there's also Discord groups where you study online. So if you do not have access to a library nearby, and if you feel like you need company of people to study along with you, these Discord groups can be helpful, because there will be plenty of people around the globe who are preparing for different exams that you can share space with and study along. And there are also Skype discussions or WhatsApp group discussions, which are going to be passive or active learning. So during my prep stage, I used to create these WhatsApp groups of people along with me who are preparing for step exams, and I will read the topics that I am reading currently along with them. So these usually happen for like 20-30 minutes, and so it'll be a great revision for me, and at the same time, it'll be a great revision for people who are also preparing. So if you're interested in doing that or being part of it, you can do that as well. These are some of the social media influencers that are there, who you can follow to have an understanding. I am also an aspirant right now. I'm still in the process of getting matched. So these are people who have already matched, and their timelines and what they have shared, the information they have given so far, is something that I have followed right now, and this has been helping my progress. So you can take these help from influencers on social media. There are so many plenty of videos that Manik Madan had uploaded previously, so you can follow that. um, Ishwari Chandran is actually a foreign medical graduate. So she, like same as Ishit Chauhan. So these are people who have studied in different countries like China, and then have matched later on into residency programs in the US. So these are places where you can get guidance from. There's Shirley Ann, who's actually a Filipino who studied in Philippines and then has graduated, has matched into an internal medicine program. And the rest of it is, there's also something called as couples match. So if you are a couple and you're seeing somebody and you both wish to get matched in the same place, you can do that as well when it comes to USMLE, because you can apply together and get matched at the same program because you both are couple. So there's something called as USMLE DUM to IM, who are a couple from India who match into a couples match. So these are things that you can take inspiration from and have an understanding. Next, when it comes to OET, it's an English exam. It has a validity for 2 years. And so I would highly suggest you to take the exam prior to when you are getting certified, because the exam is around $500. So there are four areas where it's tested: how you read, how you write, how you are able to comprehend and listen to what is being said, and how well you are able to communicate. So you need to get a B in all the areas, and it should be more than 350 or 500 to pass. So there are plenty of free resources for preparing for OET, and you can always practice speaking and writing the exam before the exam to have a realistic idea of whether you're going to pass. So there are certain formats that you need to follow while speaking for these exams: how you need to address the patient, how you need to confront them with bad news. All these are like given, so you need to understand how to speak for these exams and then pass. So when it comes to US clinical experience, this is one area that is highly viewed on your profile. You need a minimum of 3 months of US clinical experience, and there are different things. So what is an elective, what is an externship, what is an observership? So electives are things that you can do as a medical student. So there are a lot of electives that are available here, either through VSLO pathway. There is something called as VSLO, which is visiting students. Um, so this is actually going to be possible only if the medical school that you are studying in, it has WFME, which is going to be a registered school that is in the world medical school directory. So if your medical school is registered, you can apply for electives. So electives are always preferred for especially surgical and competitive specialties, because you can't imagine getting surgical opportunities or being part of a surgical team later on as a graduate. So it's always best to do electives while you are in med school. And there are externships where externships are going to be hands-on clinical rotations, where you're going to be interviewing or interacting with the patients, getting access to the electronic medical records, and speaking or discussing with the attending physician to understand how the healthcare system works. On the other hand, observership is primarily shadowing. So you're going to be shadowing a doctor or a hospital and just understand or observe how the system of healthcare works. And then there is tele rotations. With the birth of COVID, a lot of people were unable to get access to visas, and were unable to travel because of the ban of travel. So that was the time when tele-rotations were beginning. But right now, tele-rotations are not something that are highly viewed as a great addition to your CV. But if there are no other options of traveling to the US, then tele-rotations are a go still. So it's still an option, but it's not a preferable option. So all these electives and externships, you need to apply ahead. You have to make sure that you're getting the right dates at the right hospital. And there are also a long process of getting these electives. So you need to directly apply to the program or hospital. And for externships, it's always best to apply through contacts or networking. So networking is something that's very important when it comes to being in the US. So you have any relative, remote relative that's there in the US, start being friends with them. You have a friend who's an engineer, who's doing any other field of like data scientist who's there in the US, or a software engineer in the US. You just become friends with them and start having a rapport with them, because at the end of the day, how well you are able to communicate with the rest of the people and how well you are having a relationship with these people can always help you in the long run. So these are people who can share their network with you. So in any point of time, it will be helpful. So for example, giving accommodations or connecting them to their people they know of, this way it's always going to be helpful. Applying through third-party agencies, this is going to be expensive. So there are a lot of these agencies like USMLE Sarthi, USMLE Med Clerkships. There is something called as ACE Med. These are agencies that provide these rotations, but at a very high cost. So when you can apply through your contacts and when you can apply directly to the hospital, it's going to be free, or bare minimum like $200 for just getting the badge. On the other hand, if you're applying through a third-party agency, the rotations can go as expensive as $3,000 to like $8,000, which is going to make your journey a lot more expensive. So instead, if you are applying directly to the university, the entire cost of the rotation is going to be free. So those are some things that you can look for and apply earlier. So always hands-on is preferred over shadowing. Getting an EMR access is always preferable. So EMR access is like how we usually prescribe on paper, people here prescribe on computers. And so it's always better to have an EMR access and understand how the system of medical records work here. Preferably always inpatient more than outpatient. This I think I have put in terms of internal medicine or any other like pediatrics internal medicine, those that you can go for outpatient. But if you're going for surgical branches, always inpatient is preferable. And when it comes to letter of recommendation, working with a university is always preferred over working with a clinic. So that way you get a better understanding and also a better view of how the system works. So you need to like all this US clinical experience is for you to understand and learn healthcare and how the system works here in the US, and also at the same time gain knowledge of medicine. But it's not just about the letter of recommendation that you will be getting. So you cannot just constantly just go for whether I will get a university letter of recommendation, but instead you should just work on learning, because during your interviews what you learn from your rotation is what is going to be asked, not how much you paid to get that rotation. So always work on your clinical rotations and get a very good rapport with your preceptor. Next is research. I would highly suggest not to pay any agencies to get research experiences, to get authorship. So there are a lot of these people who do pay, like say, $200 or $100 to just get a authorship on a research publication. Please do not do that. Refrain from such habits. And there are so many researchers that are there here who are clinically inclined to publishing healthcare related topics. So you need to mail the primary investigator of the area of your interest based on their publications and seek to contribute. So there are something called as remote research opportunities which you can be a part of. And always you can create groups together. If you're a medical student, create groups together, find articles that you can work on. So there are so many meta-analysis or review articles that you can work on as a medical student and publish it. So these way you can get an authorship and also understand how research works. There are also plenty of summer research internships here in the US. So you can do to like few of these to enhance your understanding of how research works. So when it comes to step 3, it is not required for matching, but because step 1, USMLE step 1 has become pass fail, plenty of applicants have started this new trend of giving USMLE step 3 before their match cycle, so that they have the programs do not have to worry whether they're going to like pass this exam later on once they have matched into their program. So again, it's too early to tell you about all this, but again, this is what I'm trying to say, that primarily the concepts that you're going to be tested on your USMLE step 3 is from your step 1. So if you have a primary understanding or a better, clearer version of what you're preparing for step 3, this is going to be a piece of cake when you're giving step 3 USMLE step 3 exams, because you've already prepared all these topics for step 1 and step 2. So another thing that USMLE step 3 is set to affect is your visa, because most programs prefer to give H1B to people who have step 3 is what the idea is. So there are 2 visas, one J1 clinical and H1B that will be provided for your residency. There are both have differences, pros and cons, which you can review later on. But having a step 3 gives an edge on getting H1B visa is what it is. So finance, when you are in the beginning stages of preparing for USMLE, make sure that you are financially able to do this, because I know of people who have finished like USMLE step 1 or 2 and have done US clinical experience as well, but were strained later on because they didn't have a clear understanding of what the finances are for USMLE. Ideally, I would say in Indian money, it can range from 10 lakhs to 20 lakhs, depending on how cautiously you're spending your money and how guided you are towards your journey of USMLE. So definitely it is an expensive, because when you're comparing for example, a NEET PG exam, which is for 5,000 rupees, each USMLE step is going to be $1,000, which is going to be 85,000. So apart from that, the question banks are going to be expensive, and the travel from here to the US, like for example, India to US or any other country to the US, and then your stay here, your accommodation here, your food expenses, and the rotation expenses is going to definitely be expensive in a certain way, but it is going to be definitely worth it if you match, because the pay scale of a resident here is ranging between 4,000 to 7,000 for PGY1, and it goes beyond that. So as you grow higher in hierarchy, and doctors here are paid sufficiently, so you can make back the amount of investment that you have spent on. So always remember that this is an investment on yourself, it's not an expense. So instead of considering it as an expense, it's an investment on yourself. So invest on you the right way, and make sure that you're spending your money for the right causes. And when this is exactly what what we all want to see. So it is a game of hard work and a pinch of luck. So pray that everything works out for you. Trust the timing of your life. So there are going to be constant times where you're going to reconsider whether what you're doing, or whether is right or not, or whether it's right for you or not. And moving to a different country, already most of the participants today are actually foreign medical graduates. So you already have a glimpse of how it feels to be in a different country. So creating your own network, creating your own base here in another country is going to be a daunting process. So make sure that all of the timing works out for you. Pray constantly that you're going in the right direction. Have a mentor, and seek for help if you need it. And please do not do all this by yourself, because it can get extremely lonely and tiring. So please make sure that you are guided. So I'll open the floor for questions.
Please unmute your mic, and if you have any queries, please come forward. It's much appreciated, more appreciated. Yeah, please come forward. Anyone has any queries? Mahesh, do you have any doubts? Anyone has any queries? Yeah, Manu, go ahead.
Sir, so when you said about active,
Once again, Manu, please introduce yourself. Where are you coming from? Which year are you studying? And please ask your doubts.
so my name is Manu. I'm doing my second year MBBS in PhD Institute of Medical Sciences and Research.
Okay.
So my doubt is when you said active preparation takes 5 to 6 months. So how long do you have to study every day to actually consider it as an active preparation?
So